Hi, my name is Rob Levy, and I lead the research and measurement practice at the Financial Health Network. Let me begin by welcoming you all again to Emerge Insights. This research-focused version of Emerge has been a long time coming, and while I didn't think we'd be doing it online like this, I am thrilled with this opportunity to present to you a more in-the-weeds, get-your-hands-dirty version of our classic Emerge event. There's a meme floating around social media, and you may have heard it even in casual conversation these days, that we should hashtag cancel 2020 and just move on straight to 2021. Now, while I completely understand that desire, especially for those most impacted by the pandemic and the economic crisis, I can't support this notion for a couple of reasons. So firstly, my son was born on December 31st, 2019. So his entire life minus a few hours, has been in 2020, and it's been a great year, and I'm not willing to cancel any of that. Two, as terrible as things have been this year, physically, economically, socially, and politically, canceling 2020 means that we lose the chance to learn from it, to grow from it, and to prepare the future for a better 2021 and beyond. So as bad as things are for millions of people struggling right now, I am optimistic about the future of financial health because I'm inspired by the passion and the clarity of direction that I hear from leaders across sectors who are yearning to make change inside their organizations. Because the tools and data that are now available to understand financial health inputs and outcomes have never been more sophisticated, and because awareness of these problems that are in such desperate need of solving has never been greater. So, over the next 2 days, you will hear from some of the foremost experts and practitioners at the cutting edge of financial health research and practice, with an eye towards the past, the present, and most importantly, the future. We have split the event into 4 tracks: trends, solutions, measurement, and strategy. These tracks are designed to help answer 4 critical questions that we believe must be answered for those who are seeking to make a real impact on financial health right now. Number 1, what's really going on? Number 2, what's working to make things better? Number 3, how do we hold ourselves accountable to change? And number 4, how do we build long-term strategies for financial health? Okay, so let's break that down. To the first question, what's really going on? I want to start by acknowledging that anyone who claims to have the definitive answer about what's truly going on with regard to the economy, politics, the market, household balance sheets, the banking system, small business, you name it. If they say they really know what's going on, you should probably assume they are either lying, wrong, about to be proven wrong, or looking at such a small slice of the problem that they are missing the forest entirely. That's certainly what I've seen. So how do we avoid that conundrum? We're going to try and do that through a mix of strong, historically grounded data, diverse viewpoints, and a good dose of humility. Now you'll find all of that in our trends track, our first track, where you'll hear the latest results from the U.S. Financial Health Pulse, which is our groundbreaking but humble attempt at assessing the state of financial health. And that's, of course, never been more difficult to do than this year. Now that's going to be followed by 2 really incredible panels looking at other aspects of financial health in a pandemic, how we got here, where we might be going, and with a special lens towards young adults of color. All right, question 2. What's working to make things better? So amidst this crisis, there is tremendous pressure being put on employers, financial institutions, healthcare systems, governments, and more to go beyond just words, right? And to take action to support their employees, customers, patients, students, citizens, and communities. Now, while this pressure is long overdue, there is often little guidance for these entities about what they actually should be doing, about what works to improve financial health outcomes. Now, this is an area that the Financial Health Network and our partners have been increasingly focused on over the past several years. In the solutions track, you're going to hear from different organizations and companies talking about the importance of experimentation, testing, and behavioral economics. And you'll learn about a few specific evidence-based solutions that work, from emergency cash assistance to new savings innovations. It's going to be really fantastic. Okay, so now, if you understand the problem, and you have a sense of what might help solve it, how do you know if you're having the impact you want to have? And how do you know if that impact is coming about in an equitable manner? So how do we hold ourselves even accountable to the change we seek? That's the underlying question of our third track on measurement. Measuring financial health is the only way to really identify the pain points and challenges amongst your own customers, employees, or whatever constituencies you serve. It's also the only way to build a culture of iterative, evidence-based design within your organization, and it's the only way to know if you are getting the social impact return on your financial health investments. That said, measurement is not easy. In our measurement track, you'll hear perspectives on using measurement to unlock customer insights. You'll learn about new tools to make measurement simpler. Now, full disclosure, one of them is ours. It's new and it's pretty awesome. And you'll hear about the difficulties of measuring outcomes among underserved populations, both in the US and internationally. Finally, track 4, our 16 plus years in the financial health business have shown us that companies and organizations who have the ability to deliver financial health outcomes at scale, they need more than just data and tools and good ideas in order to be in this for the long haul and to have that kind of impact that we seek. So to our question, how do we build long-term strategies for financial health? The answer is simple. You need a system. More specifically, you need a systemic approach to integrating financial health throughout your organization, top to bottom, across silos and departments. And you need a map to get there. So in track 4 on strategy, you'll hear our latest approach to financial health integration, what we call the FinHealth Map. And then, more importantly, you'll hear from several inspiring industry leaders of diverse companies on how they advanced along their financial health journey, making an impact, making customers happy, and even making money in the process. Now, I don't have to tell any of you that we are at an incredibly precarious moment in our country. Regardless of how the next few weeks play out, we will need private and public sector leaders who are ready to take risks to improve outcomes for the millions of financially struggling households, grounded in data and with a commitment to measuring impact along the way. I hope these next 2 days will provide valuable insights to make that vision a reality. And as we move beyond 2020, whatever your verdict on this year may be, we hope you will join us in the work of improving financial health for all, now, in 2021, and beyond. It is now my pleasure to introduce my colleague Thea Guerin, the leader of the U.S. Financial Health Pulse Project, to present the results of our 2020 Trends Survey and to start to answer our first question, what's really going on? Thank you.